Minister Chris Hipkins, good morning.
Good morning.
You got fresh breaking new cases for us this morning?
I'm aware of one new case where it's a truck driver who has travelled from Northland, from Auckland up into Northland and back again. So locations of interest are being identified. I understand people are already sharing information about that. That's the main one of interest at this point.
Is that going to kill the Waikato Northland decision?
Not necessarily. I mean, truck drivers are asked to follow a number of different preventative measures so that should they test positive for COVID, they've already minimised the amount of risk. So one of the things that will happen now is just to identify exactly what the extent of the risk is. But, if they were maintaining their distance, if they were wearing a mask, if they were doing all of the things that they should be doing, then the risk should be reasonably low here.
How on top of yesterday's unlinked cases are you this morning?
I haven't had an update. Normally, around about 9, we'll get an indication of how well they've been able to link their cases from yesterday, and then, of course, we'll find out what today's case numbers are.
Are you worried? I'm listening to an increasing number of medical experts, Planck, Rod Jackson. Rod Jackson famously said the other day he's freaking out. I think it was Planck yesterday said that South Auckland's in real trouble. Do you think that's true, or are they alarmists?
It's certainly a challenging environment that we're in at the moment. COVID-19's made its way into a part of our community that's very hard to reach, and so therefore the potential for case numbers to increase is quite a significant one. And it's not necessarily to do with alert levels. Alert levels make a difference, but it is just the nature of the community that COVID-19 has infected.
Now, I've got a headache from yesterday in dealing with Ashley, so let me try and get this clear with you. Are we, and this is for Auckland and the frustration around Auckland and the damage being done to Auckland, are we looking at 90% double vaccination rate or else nothing's happening or not?
We've never set a hard and fast target, but obviously 90% is a number that would be a really encouraging start if we can get to that.
Right. Next part of the question is we're not going to get to it, and I wish I was wrong, but we're not going to. When will you blink and say we're not going to, and therefore we can move on?
Well, Auckland's currently, I think, yesterday sitting at around 87%.
Yep.
So numbers are looking very good.
No, they're not. They're 63 fully vaccinated. It's nowhere near. We're not getting to 90%. I wish we were, but we're not. When do you blink and move on from it?
Well, there's a gap between doses, obviously, but sitting at around 87% of first doses suggests that 90% is a very achievable number in Auckland.
Sorry, well, let me interrupt again. Ashley said it was a double dose. So are you going back to what Ardern said, which was 90% single jab? So is it 90% single jab because that is doable, or is Ashley, who's saying 90% double? Who are we believing here?
Oh, look, like I said, we've never set hard and fast targets. We review, when we make decisions, we review all of the information available, and vaccination rates is one of the factors that we consider in that. And recognising, too, that second doses are going up exponentially now because that big spike that we saw, about 6 weeks ago is now flowing through into people coming forward for second vaccination.
Yeah, but they're only the people already engaged. You've still got 17.7% of people who haven't had a single dose, thus preventing you from getting to 90%. The second part of my question is, if you're not going to have a target on 90%, let's look at the numbers, the case numbers. The case numbers are roughly the same as they have been for the past 6 weeks. They go up a bit, they go down a bit, they go up a bit, they go down a bit. Nothing changes. What needs to happen for some doors and businesses to open?
Well, it depends on the nature of the cases. We are seeing more unlinked cases across Auckland now. It is spreading beyond the group, the cluster that we've been dealing with. So we're seeing extra cases popping up. It's affecting a broader cross-section of the Auckland community now. And so we are, as the Prime Minister's indicated, in a transition phase from one where we...
A transition from what to what, though? That's what I'm trying to get to the bottom of. A transition, I mean, level 3 isn't elimination. It isn't working. The numbers aren't going to go down. So let's accept that. Is 90% the target? If you're not even going to say 90% is the target, what the hell are we supposed to do? What is it we're waiting for?
We'll look at a variety of things that include the age profile, for example, of the cases that we've got coming forward, because we know that the rate of severe illness and hospitalisation is greater amongst older parts of the community when they're infected with COVID. So we would look at things like that. We would look at, the ultimate number of cases, how many of them were households, which parts of the community were...
Yeah, but you've been doing that for 8 weeks now. And nothing's changed. Right. That's the point. Nothing's changed in 8 weeks. People who are losing their businesses. Do you know there's 8,500 more people who've gone on benefits since this started? 8,500 people have gone on benefits and lost their jobs. Businesses are closing. All they want to know is, what is it we need to see to get some action?
Look, I absolutely acknowledge it's really difficult time for those who are affected by the restrictions that we have in place. And we've seen this around the world. New Zealand has been fortunate that we've been relatively isolated from the effects of COVID-19.
And look where that's got us.
Well, ultimately, we've still had far fewer restrictions than most places around the world. If you look,
not these days, mate. I mean, I can get my hair cut in Sydney. I can't get it done in Auckland today.
Well, that's after 16 weeks of very stringent lockdown restrictions in New South Wales that are starting to be eased now.
Well, let me give you a piece of reading. There's a woman called Catherine Bennett, who's an epidemiologist who wrote in the Sydney Morning Herald yesterday. They opened up, as you're well aware, on 70%. She doesn't think the numbers are going to skyrocket. If they're not going to skyrocket at 70% in Sydney, why are you holding out for 90% here if you're holding out for 90%? And who the hell knows what you're holding out for? We're stuck in abeyance because you won't give us a plan or a guide.
Well, I think the key piece of feedback I can give is that the higher those vaccination rates go...
Yeah, we know that. You've said that a million times. All we're saying is at what point and when. Because this is what New South Wales did. They charted it. They said 70% and we will get there by Monday. And we had a goal. We had something to see and chase. In this country, we've got zip.
Well, I think if you look at Australia and you look at New South Wales, they've set out a number of concrete plans over the course of the last 3 or 4 months, and they've had to change them regularly. And so I think people were looking for...
They had to change anything regularly. They said 70% double dose. They said 70% double dosed and 80% double dosed. They set it out and they've achieved it.
Yeah, I think if you're looking for absolute certainty, it isn't possible at this point. We will give people certainty as quickly as we can, but there is still a heck of a lot of things that could change over the next couple of weeks. And so we are continuing to try and provide as much freedom as we can, but whilst also dealing with what is arguably one of the greatest public health risks that we've ever experienced.
Have you read Roger Partridge's piece in the Herald this morning?
No, sorry, I haven't had a chance to do that yet.
That's another piece you should read. Basically, he says what we all think, and that is you should have increased ICU capacity, and this is the reason we're being locked down at the moment, because you're freaking out about that. Why didn't you increase ICU capacity?
Well, we do have the ability to surge.
No, not the ability,
capacity.
not to surge, just increasing ICU capacity so we don't have to be in this abeyance state for so long because you're afraid your hospital beds aren't going to cover it.
Well, I think if you look at the nature of the population that we're dealing with, particularly in some parts of Auckland, even with double the ICU capacity, we could still potentially be in a situation where our health system comes under a lot of unsustainable pressure.
All right, listen, I appreciate your time as always. COVID Minister Chris Hipkins, 7:15.